Hi, it's Nick Lagos from Physio and Pilates Studios, and today we're going to take a look at a common condition of the lower leg, shin splints. So shin splints is an overuse injury of the muscles in the anterior shin, in the front of the shin, where they attach into the bone of the shin, usually on the outside part of the shin, but you can actually get shin splints also on the inside edge of the shin bone. And they're the muscles that run from your shin all the way down into your foot, and it's the overuse when you're doing things like running and jumping, weight-bearing exercise normally. So shin splints is quite a debilitating condition, but you can do a lot to treat it yourself at home. So you can do, it is an inflammatory condition, so you can do things like icing to get the swelling down and to keep it down. You can also, and you definitely need to, reduce the load of your activity when you're suffering from shin splints or when it's really inflamed. Usually we say by about 50%, really to let those muscles and their insertion into the bone rest and for the inflammation to go down. The other thing you can do is some stretches at home, which we're going to go through. So let's take a little look at those stretches now. So there's two main stretches for shin splints that we're going to go through today. And both of them basically are trying to stretch out those anterior tibial muscles. So the first stretch, let's just get Amber to bring this leg back behind you here, Amber, with the feet flat on the mat, and then just sit back on your heels. And you can see what we're doing here is really stretching those anterior muscles all the way down into the foot. And so it's the maximum stretch, and it does really work when you get the front part of the ankle flat on the ground. But obviously that can be really uncomfortable straight off, so you might put a roll towel underneath the ankle to lift that part of the ankle up a little bit higher. And as you're feeling more comfortable with the stretch, reduce the size of that towel to lower the front ankle down towards the mat and get that full stretch. Also, if you are a bit uncomfortable in the knees, you can put a pillow between your calves and your back of your thighs, just to sort of bring you up a little bit higher and take some pressure off your knees. You'd hold that stretch for about 60 seconds and then come off, and then repeat it 3 or 4 times. You might want to do that stretch before icing, just to kind of get a bit of a stretch, and then ice if you've caused any inflammation afterwards. The second thing we do usually we give our clients is a self-massage or self-soft tissue release with a foam roller. So let's take a little look at that. We'll get Amber up now. Yeah, great. Just hop on up, Amber. And you just put the foam roller down on the mat. You get Amber to put the front of the shin on the foam roller and the other foot in the front with the hands in front. And then we're going to roll forwards and backwards on the foam roller to get that pressure going through different areas of the shin. And obviously if you feel a really sore spot or a sore trigger point, you can just sort of stop in that point and then just kind of work in small little movements around it. Just to get a bit of extra pressure and try and get it to release, or just hold that point with the pressure on it, trying to relax, breathe through it to try and get that trigger point to release. So you'll be moving up and down. Obviously, to get more weight on it, you take your weight off your hands and your front foot, and you put more of the weight on the back shin to get more pressure through, so more mobilization of the soft tissues. Great. So those are the two stretches that we do, or we commonly give for shin splints. There are some strengthening exercises as well, and a whole bunch of different other strategies that you can utilize. Really suggest that you speak to your physio if you're struggling with shin splints. You could start with this kind of stuff and then speak to them to get that extra bit of rehab and return to sport. Thanks for your time.